Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about how treatable your symptoms are. How treatable is your headache? The way your headache presents can indicate the response time and how quickly you can see a turnaround. And that's something that we've over 1,000, 1,500 headache scenarios that we've been through, we know a thing or two about your symptoms, how they present, and how quickly they will respond. And so I thought breaking it down so that you can understand like how treatable is my scenario could be really helpful for you. The reason I'm willing to go into this is because there's not really a category of headache or migraine that is not treatable. Okay, so they're all treatable. There's just a varying degree of the amount of commitment and effort that it takes to get out of each of the different scenarios. I'm Dr. Taves, your host, and like I said, on this podcast, it's our mission to educate and empower everyone with headaches and migraines. We have a big mission. In order to accomplish that mission, we need you to leave us a review. If you leave us a review, it will help push the algorithm forward. Share this with someone that you know that has headaches or migraines, and that is a huge help to us. This podcast has changed lives without anyone even interacting with us. But we have people daily that reach out to us from out of state, from in Colorado, that are looking for relief because they found this podcast. They were desperate. One night they searched, headache relief or whatever they searched, and our podcast popped up. And so it does get out there and it provides hope to people. So if that is you, thank you for listening. Please share it with someone you know who has headaches or migraines. Okay. Is your headache treatable? How treatable is it? Okay. So like I just said, they're all treatable. We at Novera Headache Center don't operate from a position of looking at any type of head or facial pain and thinking, okay, this is just manifested from nowhere. This is just the brain perceiving a problem that relies on medication in order to mask symptoms. So we never take that approach indefinitely, meaning like if medication is an intervention, it's for a short period of time. Okay. Now, one of the big things, if I was going to have a line, and on one end of the line is daily headaches, on the other end of the line is intermittent, infrequent headaches. Okay, so the frequency of symptoms is one of the major factors when we're evaluating how quickly is this person or the symptoms, how quickly are they going to respond. And so we have to first ask the question, how frequent are these symptoms? Now, there is something that changes even if you have daily pain, but it's not constant. If you have a daily headache, and let's say you wake up and you're fine, and then by the afternoon, it ramps up, and maybe it's a tension type headache and it's a band or strap-like presentation in the forehead. If that's your presentation, it still is fairly treatable, meaning like you can probably see change relatively quickly. Now, if you have daily headaches, but they're constant, meaning they never go away, what I want you to do is look up my podcast on chronic daily headaches or new daily persistent headaches. I think I titled it Chronic Daily Headaches. And I go into more detail with daily headaches. But on that end of the spectrum, so a daily headache never goes away, it's constant. And typically these are, somewhere in like the 3 to 4 out of 10 pain. Maybe they get a little bit higher. The pain intensity can fluctuate, but essentially the pain never goes away. Sometimes these people can convince themselves the pain is gone if they're distracted enough, but for the most part, if they think about it, it's always there. Okay. Now, again, even if you have daily pain, but you have moments in the day where it's not there, there's a stark difference between those two. Now, again, every headache is treatable. Okay. So even if you're in the daily headache never goes away category, still treatable. The thing that it's signaling to us, that's the difference between the daily headache and sometimes it's gone, and the daily headache and it's there all the time, is generally the daily headache that's there all the time, never goes away. We have what's called central sensitization. So the brain is basically accommodated to this pain signal, and the brain is now hypersensitive to that pain signal to the point where even if you reduce tension in the neck or you reduce the signal and where it's coming from, you're likely to still experience pain because your brain is now hypersensitive to the signal. So to look at the opposite perspective, or to look at the other scenario I laid out, meaning daily headaches, but it's not necessarily constant, that just indicates that you have a high level of tension and your threshold is pretty low. And so it really doesn't take much to bump you over the edge, and you're basically hitting that headache zone on a daily basis. And even in that scenario, even with it being daily headaches, it is definitely something that can still change relatively quickly, because it doesn't necessarily mean that there's central sensitization, that the brain has become hypersensitive. But that small tweak between I have daily headaches, but sometimes I have no headache, to I have daily headaches and it's constantly there, that detail puts someone in a different category most of the time, where the central sensitization is going to play a role. Now, just a quick sort of tangent. What do we do with that central sensitization? We really just reframe what the healing process looks like. We still have to take away the underlying pain signal, meaning we have to address neck, we have to address jaw, shoulders, like the things that are going to drive the head to hurt. But ultimately, with that individual, we need to make sure they understand, like, you need to just move forward in a way that we know is healthy for your body, even if you don't see a quick turnaround. Okay? So persistence and consistency is key in that scenario. All right, now on the all the way other end of the spectrum, so very, very infrequent headaches. The thing that I want to say there is that if your headaches are infrequent, let's say you get one migraine a month, which for a lot of our patients, that would be like a dream. They'd be like, wow, one migraine a month, that's great. Now, let's say you're in that category, and I would, based on the patients we see, I would call that relatively infrequent. If you're listening to this and you have a migraine a month, it's a lot. Like, because if you lose one day a month for, the entire year, that's 12 days a year. Like, that's a lot. So don't hear me minimize that. But let's say it's, if we're comparing it to every day, once a month, not bad. Okay. And if you're dealing with one migraine a month, what I want to highlight there is, like, it's not necessarily that is directly correlated to the severity of the issue, because the body's able to compensate really well, and maybe your threshold's relatively high, and so you're not feeling the migraine symptoms on a regular basis, but when it hits you hard, and it takes like a couple days to recover. And in that scenario, it doesn't mean it's necessarily lesser of a problem. Like, you probably still have all the issues and a fair amount of neck tension, restrictions in mobility, like all the things that are irritated. It's just they are there throughout the month, but it's not something that's frequently signaling to the brain like, hey, there's an issue, because you're able to ignore it, drown it out, compensate. And so sometimes with infrequent headaches, people associate that with like, oh, this isn't as big of a problem. I'll take it to an even more extreme example. Like, sometimes kids will have like, a migraine a year or two migraines a year. And because it's not frequent enough, like, most of the time they're in good shape, it's really not considered to be an issue in the eyes of the parents or potentially even the kid. But any frequency of a migraine is signaling that there is a problem. And just because you don't feel it doesn't mean it's gone. It's just going to resurface. And then the longer it goes on, like, it's not necessarily going to like fix itself. It's the potential for increased tension goes up the longer we wait to actually fix the problem, which means increased risk of it increasing in frequency and intensity. One thing that can be true, though, is the longer it goes on, the harder it is for your brain to accommodate. And then you get to the point of you're actually, you've been compensating so long, and your brain has been like sort of taxed or stressed to the point where it just kind of gives in. And then it's like that central sensitization, the hypersensitivity to the brain makes it so it is a little bit trickier to heal. Like, it doesn't respond as quickly. Okay. So in general, and this is kind of like a no-brainer, but we always want to intervene earlier. We want to look at things upstream. We don't want to just wait until we hit the waterfall and we're falling in midair to like try to save ourselves, right? Like we want to just easily paddle to the shore when we're miles upstream. And that's kind of what we're eventually in my career, I think I will have told enough people that their neck can be an issue, that when they have early signs, then they get intervention. But for the most part, we see people after they've like feel like they've tried everything, and then we do kind of have to save them as they're like, falling off the waterfall, and it feels a little bit more dramatic. And that's not to be critical of anyone's situation, because this is like, it's debilitating pain. It's really rough, and our healthcare system does not do a good job. And so there's no blame on yourself for like not figuring this out and doing it sooner. But in general, like if we can get the word out, that's why I go back to leaving a review on the podcast. If we can get the word out, then we can like help people when they're upstream of this problem, so that it doesn't lead to a bigger issue. Okay. So frequency is a big one. The second one I want to talk about is the type of pain, and specifically location. And so in this podcast, we talk about different diagnoses. The different diagnoses that we've talked about, whether it's trigeminal neuralgia, occipital neuralgia, migraine, hemiplegic migraine, cluster headaches, tension headaches, cervicogenic headaches, all these different types of headaches. Most headache diagnoses are just based off symptoms, and so it's not necessarily there's anything objectively wrong. Most of these are known as primary headaches, meaning like the headache is the problem itself. A secondary headache, which would be a cervicogenic headache, is a headache that does stem from something, which would be the neck, okay? So when we think about the type of pain and how the pain presents, that's basically where you'll get your diagnosis, whether it's like a strap band, that'd be tension type headache. It's one-sided pounding throbbing, that'd be a migraine. If you get numbness tingling on one side of your body, that's like hemiplegic. If it's just an aura, that's atypical. And so like things like that. And so when it comes to the presentation of pain, okay? Again, on one end of the spectrum is like it hurts in your neck and then it shoots up and around on one side. Like that's your presentation. On the other end of the spectrum is you have pain all over and it's not very descriptive, and it's just kind of this dull achiness, pressure maybe, sensation that never goes away. Okay? So on that end of the spectrum where we have the very specific starts in my neck, shoots up and around, now that can be a very debilitating type of pain. Oftentimes it's described as like stabbing, ice pick, ouch, like there's severe pressure, there's severe pain. Maybe it feels like your eyeball is going to explode, something like that. But it oftentimes is associated with the neck. Maybe it starts in the neck and it wraps up and around. And generally it's worse on one side, or it's dominant on one side. Sometimes it flip-flops in people. So that presentation is a presentation that we know is very mechanically driven. Meaning if we correct the neck issue, the thing that's driving pain, we get a pretty quick response, okay? So on average, within 6 visits or so, our patients report about a 50% reduction in their symptoms. And that's because we see a lot of that like typical migraine presentation, which was over in that category. Now we also see, because we're a headache center and we're specialists, we also see the very complicated like daily persistent headaches that are described as that like pressure, kind of vague, not as descriptive in location. It's just like all over a strap, and so it's not specific to one side, it's both sides, and it just kind of generally hurts. Now that end of the spectrum is usually associated with those daily headaches, but that type of pain matched with the daily frequency is usually tougher to treat. And again, it goes back to how well is the brain in tune with what's actually happening in the body, okay? Now, on this end, where we have this specific pattern, it tells us that the brain, even though it's confusing, like neck problems for the eye, like it is able to understand, okay, the neck hurts, and then the referral pattern for the neck, and it's specific to that side, which is a good thing, because in that sense, we treat the thing that's on that side generally, and then it calms down, and then the brain can respond to that like in real time. Like we have people that come in with a one-sided pounding, throbbing throbbing, really bad migraine. And within an hour, they're walking out of the session and they feel better. Okay. So that's how quickly the brain can respond. It's like the brain doesn't necessarily need to recalibrate at all. It's just responding to a really angry neck. Whereas on the other side, the neck is also angry, but the brain is just like so fatigued and worn out. It's just really sensitive to anything. And so just like everything hurts, right? So my whole head hurts. I have pressure in my head. Like, it's not very descriptive. It's just like the brain is worn out. Okay. And so that scenario, again, when the brain is involved, when the central nervous system is involved, and it needs time to heal, to recover. It's like we need to essentially first remove the problem, then we need to let the brain recalibrate. And because there's two things at play here, and pain is subjective, right? So the brain basically is discerning and has to figure out what is actually going on when it receives a pain signal. And so the one end of the spectrum is like, okay, very mechanical. The brain understands what's happening to an extent. The other end is like the brain's so worn out, hypersensitive that we remove the problem, but there's still going to be some time before the pain actually calms down because the brain's got to recalibrate. And it's harder. It's a lot harder to like quickly just like snap your fingers or do something and get the brain to recalibrate. And so that's why the healing process can take longer with that end of things. We're equally as confident with both, though, that like we know how to help this scenario. We just need to frame the healing course based on where you fall within that paradigm. The spectrum, I should say, within the spectrum. If you're further on the side of like infrequent and it's still very debilitating, but like more specific type of pain, and then the other end of the spectrum is I get daily symptoms and it's not as descriptive. And like we're just going to have a conversation to frame this, because you staying motivated to the process is important in both, but especially important with this end of the spectrum with the daily headaches and less descriptive pain pattern. Okay. Now, another category I'll throw in here is someone who has their general health in order and someone who has kind of a chaotic health history. And so the threshold that basically your body's ability to tolerate pain is impacted by gut health, by stress levels, by hormones. And so your overall health and how your body's functioning is going to allow you to, on one end of the spectrum, like respond very quickly to just like, hey, this was just a neck issue and we clear this up and then it's good. On the other end of the spectrum, it's like, wow, you have a neck issue for sure. That's where the pain's coming from. But we also have a lot of like stress that's added to your body because your hormones are out of whack, your gut health is off, and maybe you're just at a resting level of stress. And so those things have to be considered. That's why we have our 3-spoke framework where we evaluate all those things. And so anyone along that spectrum, again, we want to help, but there's some that'll respond quicker, and that's why there's some that'll respond slower. And so we have a framing conversation at the start of our process that makes sure it ensures that you understand what the likely trajectory is, and like you're motivated to stick with it, because that's really where we find the result. These aren't small problems, so we can't really expect a small solution to a big issue. And so because these are big issues that aren't being solved, we're trying to create a really good product that like applies to even the toughest cases. Okay? So there we go. There's 3 things that hopefully help you understand your scenario. And it's like, okay, should this be something that responds quickly, or is this something like I just really got to stick with for a long amount of time? And I would encourage both scenarios to think of it as like lifestyle change for the long haul. What is healthy? What is an improvement to my health? And so if we have that philosophy and then we put the brain in a good environment where it can recalibrate, there's really not a type of head or facial pain that can't go away if we get time on our side. And that's the key to the equation, is we want to get more good stuff in that bucket. And when we get more good stuff in that bucket and then we multiply it by time, we should get the result we're looking for. That's what we try to do with both our virtual coaching and our in-person visits. And so if this sounds like, okay, I need to understand this process, if you're on one side of the spectrum or the other, we want to help you. Feel free to reach out to us. on our website, noveraheadachecenter.com. You can call our office, 719-598-1010, and we would love to help you figure this out. Thank you guys so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.